Greetings, peace and good day. I am D.Lorina, and thank you for stopping by. So, um, this week we've had a little revelation. Please excuse the ashy hands. But this is the example I'm giving when it comes to the one where I've lost color in my fingers, and my hands have gone dark, and two where I had the PET CT scan and MRI. Ever since I had that, my hands would do something funny. So if I chose not to cream my hand, it would get very dry and start to break all in the creases and become sore. But that's evidence of how far we've come after 5 years. This is where we are. I will need to put some cream on that, but not just yet. It's still okay. So, we are swelling just a bit, just a little bit again. I mean, you can see it in my face, in the belly, it's there. It's definitely a combination of food allergies plus what it triggers and what it does. But I think that we've got to part root of one of my underlying issues. Excuse me. So a diagnosis has been given, one, which is really, really good. So that will be dealt upon and put on my records from now on. But this is a lifelong thing, and it's controlled by blood thinners. So I don't know how they want me to do that, because when I was swollen like this and obviously bedbound with the pregnancy and after the pregnancy, but during the pregnancy it was really bad. I had to inject myself every day with anti-blood thinners. See, right now I'm getting a little pain, right? But this is what happened before the foot started to do all its bits and pieces. But I'm admitting now that there is something going on. And part of me not saying that I've got pains in the chest is, one, when I go, they're telling me nothing's wrong. Two, when I went to get it checked out and the man's telling me nothing's wrong, and I'm like, you are lying to me, right? Said to come back in 3 years. And so I told the doctor this yesterday. That's what the doctor said. Why 3 years? I said, I'm sure he was betting on me just dropping. The doctor said, what happens is things can change in 3 years, but 3 years is the time they give. And I was like, well, look what's happening now. The body's come to a point where it's like it's held on. I have held on. You know, we've started this up again, but I got my first main appointment with the cardiologist December. We did this we started up in March because it was March of 2022. But after waiting 2 months, or after waiting, I think 2 months after the probe assessment, and they were threatened because they were sitting on it, I was told to come back in 3 years. So that was 3 years. This now is 4 years. And this is what I'm dealing with. But it made me think about all the struggles I had as a girl. I was never one to do like long distance running or anything like that. I could run fast, but I will burn out. And if I need to run, it would just be like a short 100 meter or whatever the case is, those sprints. It wouldn't be anything other than. And I've said this time and time again, I joke about myself. I would say, you know, running for me is like going to the dean's office. Like it does something to me, but never knowing that's what it was, because I'm always tired. always exhausted. And I work hard. But I was also just thinking about the dynamics of family and how when you are the oldest, you have a lot of work to do. You're never really the one to follow your dreams unless you're adamant that no, this is me, this is what I'm doing. Uh, Not to say that I didn't put up a resistance. I did put up resistance, but only where I saw fit. Because as far as I'm concerned, I need my time. I do whatever. I don't mind helping, but when it's my time, I need my time because I'm a part of them. I'm just number one, and they're the rest. You know. So and even now with all what's been going on, I stay away and I don't tell no one what I'm going through because I get stares or it's like I'm not supposed to be unwell. And I was so vexed when I went to the cardiologist back in 2022 because a particular person knew I was going and they never gave me the heads up of the family history. And I was not pleased about that because what they were suspecting is what that one was diagnosed with. That would have helped in terms of them being more lenient to the fact that something may be wrong with me, you know? But they told me straight, no. Now I was like, I waited years for that, right? For that appointment to be told no. I was like, what do I do? What do I do? I expressed this to a cousin of mine. I'm in pain. What do I do? Who's going to believe me? So I went home later that year when they was talking about the wanting to go and dig to look at a benign swelling on the back of my back of the thyroid, which is the parathyroid. I just said, am I able to go away? Because I've waited. I've got myself up until this point. That's me looking after my health up until this point, and I'm okay. Can I go away? Oh, well, the surgeons, they're good. I just could not afford to contract any type of infection, get any type of sickness. I didn't want no one opening me again. I didn't want nothing. I just wanted to go home the way I was, you know? And I can handle this. The only thing I failed to do when I went home is just be straight out vegan and not touch any dairy products. And I did touch dairy, and sugar types. So that's my downfall when it comes to uh, eradicating some of the bacteria plus whatever else was going on in my system. Um, because I had an appetite when I came back home. I was able to eat things and also keep weight on. So, not to say what I was doing wasn't working, it was obviously working, but it was just that was the last hurdle, and I didn't adhere to the hurdle, basically. So, right now, I feel like I can stop for a second. It's Friday. I walked back home. I conducted my Jummah prayer an hour later. When it was Jummah prayer time, I was actually recording this and I was maybe like just under 2 miles away from home. More on the mile and a half, but just under 2 miles from home. And yeah, I just wanted to get home because it's cold out there. And I had all the heavy bags on me. So I think I went as far as Bayswater, if anybody is familiar with Bayswater. And at 12 o'clock I left and I continued to walk all the way home. So when I got home, it was definitely under the hour. Definitely under, I'm sure it took me maybe another 15, 20 minutes tops to get home. So by the time I did all what I needed to do and I looked at the clock, it was time to do my Juma, which I did. But I'm just sitting here and I'm relaxing. I fancied some ice. I've been fancying some ice. So I have some ice in the glass there. And I'm not going through all of that rigmarole again with my deep freezer just to get some more ice. That's it. I was supposed to put some in a bowl and put it in the fridge, but that's it. We'll save that fight for another day. Um, yeah, I actually feel to send my mother a message or just to call her just to say, look this up, because she'll look it up. But I also intend to have her and my father together. This was just something I wanted to do for a long time. It was just in my mind to do it, get this place how I want it, how I want to see it, and get a routine about me, and then invite just the two of them for dinner. I won't be eating. They'll eat. And then I'll talk to them too properly, because I'm a sensible person and I don't think they understand the family that they brought in this world. Myself and my brother are very, I'm not to say my other siblings are not like us, they very much are. But we are very family, just us type of family orientated. We like to do things a certain way, um, but we're very much to the book. Me and him, we count each step we take. And again, I'm not saying the other two don't. They definitely do. But they're more at ease than we are. I think for us, things have to go a certain way. He's an asthmatic, and I now obviously have this. I do have asthma. The other two suffer with eczema. So anything else it's not, I find that when you have those type of chronic symptoms, um, I mean, anytime my younger brother would eat cheese, his skin would just do something awful. And you always know when someone's got eczema and it's the cheese because of the way the skin just. But he's got himself under control in a sense of how he takes care of himself. And I love to see that. Um, yeah, I love to see that. He's the one I used to just uh, make bean soup and bring it round every Friday for him so that he can have his soup, and I bring him a loaf of bread so he can have it toasted or however he wants to do his stuff, make his sandwiches or whatever. I used to do that for him every Friday when he was going through his treatments as a teenager and young adult. That's a hard thing to go through in terms of health and lifestyle. um and my other brother, I know he has his asthma, and he had one attack when he was young, and that was scary because he woke us up, and just hearing his back getting beat, you know, and he's gasping for air. I mean, my other sister, I don't even think she remembers hers, but she was in hospital for like a good week when she was a baby. I mean, even now, I think we do our best not to tell her most things. I'm saying this quite publicly, but we do our best not to tell her most things, because as much as she is tough on the outside, she's very soft. She loves her people, and so they're more they're more expressive, whereas me and my other brother, we're not. We're very much, I wouldn't say we're rigid, but we know how to just go about our day, and we could be in pain and we could be suffering inside, but you're not gonna know about that because we're not gonna let you know. And so, and we're not going to do anything that's too left field for you to know that that's what's happening. And that's the difference, I suppose, in just how we conduct our business. But for me, because I'm always helpful and I'm always on the go, but for me, it's always been diet that's helped me. And I know why, because I know what I face, I know what I'm under, the pressures. Um, Again, I don't burden people with my bother, with my illness. But this time around, I did make it known. But it's like that was mixed with the drama of the separation between me and my ex-husband. That to me seemed more juicy to people than my actual health. And what I tried to explain to my mother the other day is that that got in the way of me trying to figure out what was wrong with me. And I just wanted to be left alone. I wanted to be left alone. And I said, when I say something's not right, I want that to be taken seriously, because it wasn't taken seriously. And this is the point I'm making. I removed myself from everybody because I need to find out what's wrong with me personally. But whilst I'm by myself, I just want to relax. I just want my head to just be, even if it's not thinking of anything, I just want to do this. And this is why I'm doing these videos, because I'm hoping as time progress that, I would take you along this. I never knew that my health was going to do this December. I started doing the lemon cleanse reviews the month before, but during that time, just after that, was when my body started to get sick again. But I was losing a lot of weight through the cleanse naturally. But I did notice an increase of tiredness, energy, and I was conserving my energy. Just to do the simplest things was hard for me. And when I did the walk, it was, yeah, I had the pains, and I went to the doctor, and he tried to tell me nothing's wrong. You're young, as they like to keep palming people off with. And yeah, we're coming down to, I mean, no one's out of the woodworks, because there are loads of things that fall under that category in terms of what can happen to you and lifestyle. Palliative care is one of them, because once it starts its rubbish, just like the other day, like December, this is why I called the ambulance, because I knew I was sitting here. I felt like I was going. And I didn't know how I was going to look after myself, because I did not know what I was dealing with. Put yourself in that position. Your body's swelling, is filling up with fluid, and you could feel it. Everything is tight, right? You can feel it coming up your craw. You know that you're trying not to get fluid go this way, anywhere past here. You want to keep everything down that way, right? You're sitting and you can feel it rising in your back. Your legs are expanding. Your arms are feeling a little something, and even like the face just did its thing. You're getting a little wispy, and you're like checking yourself just to make sure everything's okay. The man said to me today, "Do you have asthma?" Yes, I've got a. Is it controlled? That's controlled. Yes. Because last week when I was trying to counsel and the man wanted to be rude, is because I caught a draft. And with catching the draft, as much as I wanted to fast, I couldn't fast. It might have helped, but it gets very cold in here. And the one thing I don't want is for that feeling to come down here and then go into my lungs because of where I was. I had no reflex, I had no strength to cough or even do this. I didn't have any of that to gather that strength to bring and lift. And it's not even that, I don't even know what would have happened, you know? So I'm truly, truly grateful that again, it's my nutrition. I know what to do when the time comes. When this thing here happened, I didn't know. But the moment I was sent home, I knew what to buy. I knew what to get. And it's helped me build my strength, because the aim here is to rebuild the body's defenses, because the defenses is doing its thing. It's broken down a little bit before it starts, but you've got to feed the body to strengthen what needs to defend. So today when I was speaking to the surgeon, and he said something to me, and I was like, yeah. I said, yeah, I was actually thinking today that that's my little fighter jet. He laughed, because that one comes in play, to help with whatever was happening, it was active, you know. So yeah, I've learned a lot in this time. Again, this journey to self-love is, things that I would see, what's the point? Like, what things have to have meaning for me. If it doesn't have meaning, then I'm not doing it just because. And that's the part of me that I do need to learn um, to not do, but this applies to specific things. I'm not a follower, I'm a leader in my own right. And I don't do things unless I know the reason why I'm doing it. So I've wanted always like a little morning routine, and I do have a routine. But when it comes to like body conditioning, and I'm not one to meditate. Some What I used to class as meditation is, once I finish read the Holy Quran, I would sit down and be with my thoughts with regards to what I've read. Whatever comes to my head, I'll write it down. If nothing comes to my head, I don't. Sometimes I want to sleep. It's so much information at once. Sometimes you read something over and over again and you get a different understanding. And sometimes I just sleep that out, and wake up again, and then we do what we do. But I used to set myself 20 minutes, half an hour to do some type of active physical exercise, but I haven't got around to doing that, because what I'm doing now is I'm trying to restudy and study plus do some other things. So, but I'm trying to get that all incorporated into a routine whilst I deal with my health. you know so things keep doing its thing, but we're narrowing and we're narrowing. I feel like having to do this it's like a training ground. Again, I say that, but this is my life here. But it's just in terms of packing bags and uh, making sure I've got food and what I can buy and the prices, and just little things I keep note on, because I like to make everything quite precise in its thing. And my brother is like that. I know my sister and my younger brother is like that too. My sister's got her routine. My brother, I've seen the way he would like to keep his place a certain way, and the other one. Everyone does run off a routine. That I know we do. Um, and so for me now with this thing here, I want to talk to my parents differently. I had it in mind to speak to them and to cook for them and talk to them. But this time around, I have it in mind to talk to them differently and explain to them what's going on here. And state, my dad knows something's not right. He knows health wise something's not right. He looks at me and he knows. My mother, on the other hand, she would know something's not right, but she will turn a blind eye to it and try to just make life a certain way. But you can't shade or hide the fact that something is not right. The one thing that they both advised me on, which I did start, and I've said it yesterday and what have you, is my dad told me to just make sure I walk. And my mom said to me, just make sure I cycle, at least just to get the legs moving, at least 5 minutes. Just continue the cycling. And my dad said to continue the walking. And that's what I was doing, you know. But I haven't been active. And yeah, yeah. We're going to get to the bottom of this and we're going to deal with it, because I said to the surgeon today, I just want to have not a carefree lifestyle, but just have a lifestyle if I can. I forgot the word I use, but you understand what I mean. Quality of life, just a quality, just live life a certain way and not worry about health, not worry about if I eat this, is this going to happen to me? Or, just be ready. So, hopefully, inshallah, everyone's working with me this time around. And I've kept everybody else out. We don't want no favors. We want some proper work done here. And we want it conducted by those who truly love medicine and just wants to be of assistance to someone to help them along their way, and that's it. And that's how it should be in life. So the sun is going that way. And I'm gonna just relax. I'm going to chill out for the rest of the day. I'm not going to do anything. And yeah, that's it for me. So I thank you for stopping by. I am D.Lorina. Peace and good day.